how will I look after surgery? Big one. This is my last one, by the way, guys. I'm gonna give you fair warn. This is my last pre dis, dis pre pre programmed, pre-asked question type thing. So happy to take any questions live as ever. But if you, this is my last one. Also, how do you give? Oh no, this is the question. How do you give clients an idea of how they will look after surgery? I mean, it's a massive question. This one. This is a patient having breast implants. It's difficult. I'm sorry to say, it's difficult. I think a lot of people think it's a lot more sort of precise than it is. And there's loads of different things you can do. You've got 3D imaging where you can take a photo of yourself and morph the photo, and show the photo what it would look like with implants. It would, to me, else you can morph anything. Rhino, nose job and breast implants, breast lift. You can morph the picture to make it look like you've had implants and things. Peter, have you seen the one with the virtual? You put the goggles on, virtual reality, and you look at yourself. Um, uh, I mean, it's the bottom line is it's difficult, and there's no any time there's lots of ways of doing something. There's no good way of doing something. So so what we do is we do certainly for implants, we do a sort of a mix of things. We've got sizes in the clinic which we can put into the breast and give an idea about volume. That's just really volume, doesn't really tell you much about shape, but gives you an idea. If you don't want to be a C cup or a D cup, the sizes are a bit better because the size is like that's 250 cc's, and so yeah, that's the sort of volume I want. So it's a bit more specific than saying a C or a D cup, but it doesn't really talk about shape. The most important thing with implants is the width. So the width of your breast or your chest is set. So there'll be a certain group of implants that will fit your frame already. And then you look at the shape and profile, and we do that by looking at different before and after photos of people with different shapes and profiles to try and get an idea what sort of shape and what sort of profile of implant will give you the look that you want. But it is always difficult because you've got to add that shape and profile to the shape of your breast currently. So if you say, "Oh, my friend's got a moderate profile 250 cc implant," can I have the same? Well, it might not look the same on you because your friend's frame might be different to yours. Your friend's breast shape might be different to yours. So it's difficult, and that is why we only charge for the initial consultation. And I always say to people, come back. Encourage you to come back time and time again. Go over it again. We'll talk about it to try and make sure you're absolutely comfortable with the implant choice before going ahead with it. Because two things I'd say. First of all, you have to be comfortable with it in your mind. Um, because if you are unhappy with the implant, if you have surgery, we say, oh look, we got this guarantee, warranty, we'll look after you and all this sort of thing, which we will. But if it's just purely the size of the implant you're not happy with, that's not covered. So if you're like, you know what, actually I don't like these 250s, can I have the 350s? That's not covered. So you've got to be sure about the implant choice before you have surgery, because if it's purely the size of the implants that you're not happy with, if they're not right, if they're sitting high, sitting wide, sitting low, if there's a problem with them, swollen up or anything like that, we will fix it, no problem at all. But if it's purely just, oh, actually, you know what, I change my mind, I want the big ones. That's, that's not covered. You have to pay. So that's number one thing. Number two thing is that it doesn't actually matter as much as you think. You have to get the implant sitting right. I would always say choosing your surgeon is probably more important than choosing your implant. Obviously, it's important to choose the right implant, but if you get an implant not sitting right, too high, too wide, too low, whatever, one's out here, the other's out there, it's not going to look right. Doesn't matter what implant it is. So that is crucial, but something that people don't really spend much time considering. It's not fair. They probably do spend a lot of time considering it, but I think people don't realize how important that is. They think, actually, should I have the 240s or the 260s? It often doesn't matter too much when it comes down to sort of one or two. There's millimeters difference in the size, and people get very um, invested in it and think, actually, I'm not sure which one to have. Actually, I have the 260s. Okay, as long as the width is right, as long as the profile's right, the difference between 240, 260, whatever, it's probably going to have a marginal effect, but the positioning of them is going to have a big effect. So that is more important than actually